there is no doubt that AI will impact on care and will and should result in better and more cost-effective care delivery. Whether we can be sufficiently organized and sufficiently clear and sufficiently accepting of AI in healthcare to implement it into our healthcare systems and ultimately into our guidelines in a quick and efficient fashion will remain to be seen. My concern is that there is incredibly little use of AI in direct care at the moment. And there seems to be more concern about AI and the risks of it than there is about backing and moving directly forward with the benefits that have already been shown. And there is a lack of acknowledgement of the fact that just because it can perform effectively in some way, that immediately assumes the fact that it's going to be adopted in care at scale. So I think there is a number of things holding things up. One being that there's lots of pilots, but very little implementation in direct care as clinical business as usual. And we are paralyzed in some respects by the concerns about AI and indeed the social perception of AI. AI is considered somewhat scary out there in the community. And the more we as healthcare professionals continue to refer to risk, the more our patients will pick up on that risk and be resistant to change. But as diagnostic tools, which are already being shown to be superior in terms of diagnostic accuracy to even the most specialist human healthcare professionals, there is no doubt that at the diagnostic level, we will be seeing AI implemented into the toolkit and will get into the guidelines soon, I hope. But we're talking decades of change. We continue to be shackled by 19th century principles in healthcare, about which we have 150 years of clinical science. And these are our conventional clinical touchstones that we can't just cast off in the new world of AI and all it can tell us. So we will have a parallel universe for what will be decades, whereby new clinical science revealed by AI and truly superhuman insights that we have not been able to detect now will greatly sharpen the tools we have available. But this will have to be alongside the conventional blunter tools. Blood pressure is an example. We only measure blood pressure because 150 years ago someone discovered they could. There is no other reason, but we are now shackled to 150 years of clinical science that we are unable and it should not simply cast aside. And so the new world of insight through AI will be a parallel track for long enough for us to become comfortable, to relate the new insights to the old world of 19th century principles, and then we will ultimately be able to jump to the other track and have much sharper tools.